about what an informed consent would be like. The only thing we can do is try to align with communal paradigms. I think that's the best we can offer.
I think I would agree, and just slightly back there, that you are right, that we have to adapt to the community. But I think some principles are still the same. We have to figure out how the principles will work. So that, for instance, if I know that the individual that I'm interested in is not the one making the decision, then the one making the decision who is a community leader should understand a little bit more. Like, I feel like if he's the one making the decision, he should know the ins and outs of things if he's going to be deciding on behalf of somebody else. That's all that I'm saying, that if this one is not making the decision, this guy is making the decision, then he should know about the risk, he should know about the results, he should know about the benefits. Like, he should know all of those things so that he can decide well for his community, and not just how much money it's going to bring to the community.
I want you leading my community.
So I actually liked that community leader, because usually, and I think Nanu will tell you this, when you go to the community, they kind of know what you want them to say. And I'm very impressed with him that he just said what was in his heart rather than, because he could have. I don't think he doesn't understand risks, benefits, that's how it's supposed to be and that's the way it's supposed to be. And I'll tell you why I know that he probably knows it, and I was happy that he was being honest. We were doing a prep trial in Kisumu. This is prevention of HIV, Kenya. So you take a pill every day, and if your partner has got HIV, you don't get the HIV. Okay? So we were doing 2 trials. We were doing fem prep, women only, women who are at high risk. So you saw the little girl in Majengo, that kind of person, yeah? So you take people like those, because they're having many sexual partners, they're having a lot of sex. You tell them, you take this pill, you will not get HIV. Because I was fem prep. And then there was couples prep. Couples prep, we're taking couples. There's a husband and a wife. One of them is positive, one of them is negative. The negative one, we are taking the prep. Those trials were running concurrently. Now let me tell you what happened. The fem prep trial ended because of futility. The girls were not taking their medicines, and they showed no difference between the girls taking their medicines and the girls not taking their medicines. So they said, you know what, we're going to stop this study, it's no point, right? In fact, we felt the drug Truvada wasn't working. We said Truvada is not working. That's what a thought came, all right? So now we were doing fem prep and couples prep together. So we had to tell the people in couples prep that, hey, you're in couples prep, you're taking Truvada, but we've just stopped the study in fem prep because Truvada doesn't seem to be working. We have to tell you that it has failed. We have to tell you that this study has failed. We've closed it because of futility. There was no difference between the HIV prevalence of the people who are taking Truvada and the people who are not taking Truvada, okay? So, when we did that now for couples prep, now, $1 late, is it a day late and $1 short? Somebody said, why don't we ask what happened? Qualitative now. Because we had done our quant, and our quant had shown there was no difference. Why don't we ask these girls what was going on, you know? But it was too late, the study had already been closed. And when the girls were asked, it turned out that they didn't feel they were at risk. But the most interesting thing about this story is that the girls were having a conversation in the toilet. I'm calling them girls. Men don't like being called boys, but girls will like being called girls. Especially the older you get, you want to be called a girl. So they come into Siaya Hospital, and they'll go to the toilet and talk amongst themselves. And in that conversation, one of the girls was saying, you know what, taking this medicine is too much work. I sometimes don't remember. Now they're making me look pregnant. My stomach is fat. I don't have a shape. You know, she was really complaining about the drug and the side effects. And then the other girl told her, Hiya, you mean you're taking the drug? She said, yeah. She says, why? She said, yeah, throw mine. Where do you throw them? There was a place called HIV Lane, just outside the hospital. They'd come and throw all their pills. So that black box would be empty when they came to see the doctors. So this other girl said, but they'll catch you. They've been taking our blood. They'll catch you. They'll know you've not been taking your medicine. And then she said, no, they don't. Why? It's a double-blind study. I kid you not. That participant said it's a double-blind study. Nobody knows who's taking the drug. impression that the community, like that guy, he looked confused. Mara yes, Mara no, hey, he's not confused. He understands it perfectly, and I gave him marks for not giving the appropriate answer. The community is very clear about what you're doing. But they also want you to continue doing it. So they are not going to tell you what you don't want to hear so that you stop doing it. So we need to disabuse ourselves of the fact that they didn't understand just because of the way he answered. Now that's an added complication to that story, but what I'm just trying to say is making sure that you've ticked all the boxes, they are qualified, they understood, they did all of this. At the end of the day, people do things because of reasons you have got no idea. You may have done your absolute best, you would have followed all the rules, you go back and ask them and they'll tell you something that you wanted. If they understand, but yes they did, but at that particular time it was convenient for them to be in the study. So I just wanted to say that, I know it would be good, and by the way, where we are going towards, maybe we'll move away from the informed consent document and maybe we'll start talking about how we train our RAs, research assistants. Because all of this might tell us that the consent document may remain the way it is, but the way it is explained, if you've done proper community engagement, you may be able to explain it in a way that will still bring up the risks without doing it in that linear fashion. So, Bramwell, that going round and round and round, maybe you don't have to go round and round and round in the informed consent document, but you can go round and round and round when you're doing the consent process. You can keep on flipping that this way, that way, until it is not even for you, it's for them. For them to finally, in their brain, the way you can go and see as a counselor or a psychologist, they know what's wrong with you from the minute you walk in. But they take you round and round and round and round and round until one is, oh, I'm a bossy boot, I'm a controller. When you walk in, they're not going to tell you that you're a controller, you walk out. So maybe that's the way you can train research assistants or people who are doing, because I actually have a problem with doctors doing consenting. I have a big problem. Even if you don't wear your stethoscope or your white coat, I can smell a doctor. Even when I'm going to get onto an aeroplane, I can tell who the doctors are. It's just the way you're trained. You're trained in a certain way. So I just don't use a doctor. Because I can't behave the way you guys behave because I'm not a doctor. But you guys, you're just, shall I tell you one thing about doctors? Yes. The way you look at people, it's so strange. It's like you have X-ray vision. It's like you're looking inside. You look and you look and you look. So in your head you're saying, she looks like she has anemia. Look at the way she's walking. I don't know what you're saying in your heads. But do you agree? The doctors stare at you. Doctors stare. Look, okay, you don't stare, you look.
They're thinking through many things they will not tell you.
Anything anybody wants to say about this poor
Because we're
guy?
trying not to interrupt. It's what our face does when we're trying to say, don't interrupt the patient, don't interrupt the patient, don't interrupt the patient.
But then now when they're just having normal conversations, you still look at us. Okay, let's move on because of time, and also because we haven't even heard from the participants themselves. We are still at the head honcho. Okay, go ahead.
Then we met the research subjects and started with the wife of a community leader, as she was thought to be most informed. We asked her, what do you know about the study?
I don't know anything.
When you don't know about the study, then why do you consent for it?
They have come to my house. How can I refuse?
Can you refuse if you want to?
No.
We visited another contrasting home where the mother believes that the medicines are not helping her child.
My child is not benefiting despite the medicines.
Do you know that some children may not be getting the medicine?
No, but my child is getting the medicines without any benefit.
Then we meet the mother who is very happy with the project. Did they take your permission to put you on the project?
Yes,
What permission did they take?
I went to the center. They checked me, took my blood and gave medicines.
Why did they do the blood tests?
To treat my illness and swelling.
आपको क्या फायदा होगा इससे? इल्ला फायदा थियो. फायदा हुआ? हाँ, आराम में गोलियों दिनों में गाड़ियों ताकत जो गोलियों दिनों ना. अच्छा. दवाइयों दिनों वो देता खाई तो भाई होता है. तो आपसे जो खून लिया उसका क्या करेंगे ये? खून दे. हे खून मसराई. हाँ, खून का क्या होता है? खून का क्या करता है? खून में जो है रिपोर्ट तपन. रिपोर्ट नहीं मिली आपको? ना. लेकिन आपको दवाइयाँ दी हैं? हाँ, दवा मिली.
What if you refuse to participate?
I don't want to refuse.
What you will if you refuse?
If I don't give blood, I won't get the medicines.
Do you understand the difference between treatment and research?
Yes, the medicines are good.
Then we visit a relatively more aware mother.
Do they take consent before filling the forms? Yes. What did they ask? They say it's good for you. Is it treatment? They said we will give medicines for your children. What is the benefit of this project? Our children are growing much better ever since the treatment has started. Do you understand the difference between treatment and research? Yes. What do you understand? Children grew poorly before the project started. Now they are much better. What if you refuse the consent? If I refuse, will it be helpful or harmful? Harmful. If I refuse, I won't get any medicines. Do you think all children are receiving the same medicines? Yes, all are the same. Do you know that the medicines can be different? No, I don't know.
Okay. Research participant. You almost feel like stopping doing research. But you won't stop. Oh, you are so sad. Wasn't it unfortunate how the community leader's wife, who is up, and they said they assumed she would know the most. And she had absolutely no idea. It's really unfortunate.
I also feel that there is a condition. If you do not consent, then you won't get medicine. Like in the Shah now, if you do not register,
You will not get
you
medicine.
won't get medicine. Yes.
So the community had connection.
So it is not voluntary. It's not voluntary. And again, when we get the community leader saying that it is not compulsory, look at the office of this man. He is not a simple person. And if the two will now say no, or while the others have been convinced to accept. So also using high offices in convincing people is a bit worrying.
Good points came back. But at the end of the day, we have to do research.
in the vulnerable population. So how do we do it? There's a term for what those ladies were saying. There's a term in ethics. It ends with misconception. What does it start with? Does anybody know? Even if you don't know, it's okay. Something called therapeutic misconception. So in the minds of the participants, they think they are being treated.
Is it only in the minds of the participant or even the community leader? They say it is treatment. So probably the researchers have even misguided the community leader.
Do you think so? Do you think it's the researchers that have miscommunicated or misguided the community?
I have a strong feeling the researchers had a hand in playing, at least not giving the whole information, because if they'd wanted to, it appears like they had translators and all. They would obtain some degree of understanding of how much the participants know. They would not, say that if you're not getting blood draws, you're not getting medication. So it sounds like what the participants are saying suggests that I would implicate the researchers as well. Even if not directly, then just for being passive in that process and not trying to obtain how much their participants understand. And even delegating, even if they were to say, they're doing the communal autonomy that we're talking about, then, not playing a hand at all in how that consent process is administered and even giving partial information to the leader. We don't know that all of it was told to him, maybe it's... So I feel they do play a role, even if indirect, I would implicate them as well.
Like, just to support the idea, like one of the mamas, she has said, the medicine is not working, but yet she's taking it.
Yeah, she says it's not working.
Yeah.
Yeah, it's not working for her child here, but she's continuing to live, but she's unhappy. But there's another one who is working, and she's happy. But both of them are still in the study. And they're in the study because they're still thinking that this is a medicine that they're being given to help them. I think they've totally missed the point that this is research. And they missed the point that half of them are not even getting the medicine. And maybe that's why you're suspecting the researchers, because you feel that they would not be foolish enough to tell people that I'm giving you something that is not going to work. I know there's no medicine in this pill, I'm just giving it to you because I want to do research. Because that's essentially what you have to tell them. Yeah, it is, swallow it, but it has nothing. It may have nothing. But of course, as patients, because we've been patients before, we always feel that the doctor has the best interest for yourself. So you'll be saying, he must be kidding. Why would he give it to me if it was not going to help you?
I also think when she starts, when she goes back to swelling, as is bound to happen as the pregnancy advances, she will now start saying the medicine is not working. It goes back to the point whereby the community leader, how he understood it, is that this is purely beneficial. Like there is no harm at all. All of this is beneficial. And therefore it goes back to wherever this approval was given, they did not advocate well enough for this community. Maybe they're the ones who should have advocated for this community, knowing that the community is like this.
But now when I hear something like that, I feel that we are learning now. Because as an ethics committee, that's your job. Your job is to say these guys are not going to get it. So how are we going to make sure, one, that the study is not harmful? Because if a study is very harmful, then you have done a lot of harm. And this one was not perhaps too harmful because it was about giving folic acid and what it can end up being something very harmful, but so far it was also harmful. But so now as ethics committees, you've seen a community who is totally clueless. So now it's your job to try and make sure that you can protect them in a way. But before I listen to the Prime Minister, how would you interpret placebo to a lay person? Because that's just it, isn't it? They all think they're getting the drug. So we feel that they were not explained to properly. Okay, so now let's explain properly what placebo means.
It's like being given a sweet. You want to be very like one person gets medication, another person gets a sweet. Yeah. Because if you tell them it's nothing, that may not be very well visualized in their minds what nothing means. They still see a pill which looks exactly like, yeah.
So you'll tell them this pill is like a sweet. So you can sukari. They are very literal.
Yeah.
And you're really trying to paint a picture in their mind.
Mm-hmm.
Yes, rice and then.
So I'm thinking, if let's say those participants actually had a condition, I would look at a placebo. I would tell them this is a medicine that I'm assuming it's standard therapy. I'm not assuming it's a sweeter. I'm just assuming we are comparing standard therapy at that given time.
This particular one was placebo. Was placebo. Not standard.
So I thought in some context placebo could mean.
In this particular one, they were given a pill. That's why that lady was saying
it was like chalk.
Yeah, it was something that they actually swallowed that looked like what the other people saw.
Yeah, so that one will be very, very hard, to be honest, to tell somebody that they're just getting something that resembles medicine.
Which begs my question, it would be easier if I tell somebody, or rather the participant, that this is what we normally use. Let's say this is paracetamol, but this is something new. We are trying to see.
That is easier.
Yeah. But if you just like chalk, or sweet, it's going to be hard.
Look, and because we are very unhappy with the researchers right now. But
Yeah.
you can imagine now trying to explain to somebody.
Yeah, I would just add, I would say, this one here, or one of them will have the medicine that we want to look at. The other one, it will look the same, but the medicine will actually not be. The medicine will not be in it. So that they're saying this holds the medicine. You may have one with medicine in it, or you may have. Now they may try to cut it open and see if there's something inside. I don't know, but it could have the appearance, but one might have
That's quite close, I think. And I hope if I was the research participant, I'd say, but why are you doing that?
I think the point comes to that point. Usually when we test new drugs, usually we have to find a specific group of people who have a knowledge or who have awareness about what they have and what's currently available. So they are kind of heroes, every one of them, because they have volunteered so that we can have the research, so that the next generation can benefit from the research. So the explanation will be, yes, we don't have proper drug, we are trying this one.
But some of you are not going to be given one that is going to help you. Some of you are going to be given something that is not going to help you. It makes no difference whether you take it. I don't know which ones you're going to use, but I think that's the crux of the matter, how to explain it. Yes, Anne.
So it's maybe what you said, and just to combine, I wonder if it would be easier if the community themselves understand that this is a problem that they all have. When you're designing when you're saying there's a problem, there's a low birth rate problem, it's a problem. But this community, do they understand that that's a problem? So therefore, when we are trying to now disseminate this information, they own it, so they can understand. Some of us will get the medication, others will not see whether that problem will be solved. I wonder if they understood it better, they would have a better buy-in, so that they could be the ones, or maybe they are not the ones.
So just to confuse matters even more, some people don't think that we have our own cultural beliefs as to what gives low birth weight. So if they say, no, that's not true, it's just that Lillian gave me a bad eye. Yeah, aliniangalia vibaya. Sorry, Lillian. Sio wewe lakini. Do you know, I'm telling you, research, we don't give researchers enough credit for trying to do this research process.
Yes.
Yes, it's hard work.
Yes.
It's really hard work. And there are some researchers who are a little bit, will go the extra mile, and there are some researchers who just want to get through it like labor. Just get through it and be done with it, right? But it's really hard work, because I remember in Kibera, there was children were diarrheaing, and they did a qualitative research to see whether people understand where the diarrhea comes from. And you know what the lady said? It's because she hung her clothes outside after 5 o'clock. That's where the child got diarrhea. So hiyo kizungu yako yote yao Kiswahili yote. She knows why the child got diarrhea. In Kisii, if your child gets colic and is always crying, it's because they wear red outfits. So all you have to do is to change the color of the outfit to give, and the baby will no longer cry. Okay, so you come now with your study. You start saying that they drank bad water. Which bad water? Finally, then we'll see the last section.
The explanation of placebo.
Yes.
Maybe if you were to meet the participants and you know that we have 2 tablets, we don't know which is which, we were giving to you, but one has medicinal benefits, the other one does not. So they are packaged in, one is in yellow, one is in red. If you pick yellow, you will be taking yellow for the entire process. Then maybe after it, you will do some tests to confirm the one you are taking. I think it could be an approach as well. Then,
but you know, when you're doing a placebo trial, you don't have different colored pills.
no, maybe the packaging.
Even everything is the same.
Maybe I made two kinds of samosa. I made one with mocha, another with tuna. And well, I don't know.
Okay, but yes, I'm glad that you're really trying to wrap your mind about this. But in a double-blind study, it is only actually the pharmacist who knows what they got in you. The doctors don't know, you don't know, the pills are exactly the same.
I think in my mind, the way I could probably try is that, you make soup.
Yes.
They all look the same.
Yes.
In one soup, we blended some meat.
Yes.
In the other soup, we not blended some meat.
Yes.
But you don't know the difference.
Yes.
But they all look the same. You just don't know whether you're taking the soup
meat
from blended meat and this one without blended meat.
So
that would be just a light moment. That would be soup, Western soup. If one soup has meat and another does not, everyone will know this. But yeah, that's just a
no, but he says like but I think he's getting close to it. You really need to find something that in the community could illustrate, the fact that something has something and something, something doesn't have something, But yes, you're getting close to it. But you see again, a time will come and you'll review 10 proposals, 20 proposals, 30 proposals in a month. You're not going to think of Egusu when you look at the informed consent. You just say, this makes sense. Placebo. This who doesn't know placebo, you see. So it's only in trainings like this where we think very hard. But when now you're under pressure of review, it might not occur to you, or it may occur to you. And you might start saying that, this is not as sufficient. Even in English, when they explain it, it's not sufficient. Yes, let's have the last one from Lynn when we finish, because I think my time is run away. And Lillian and Diana, you're going to have to say something. Nobody's going home. Say something. So umeshika hawa wote mahali.
I was just going to say, it is a good idea to try to find, if we can find something in the community to compare to, even if it was the idea of taking a test in school.
Yeah.
Maybe you have both been sitting there, but the test will show at the end, whether you've learned or not learned. So I think it would depend on the community what that might look like. So it would take a lot of work, I guess. But to really know the community might figure out that variable.
Yep. So we are now at the end, so we just finished seeing this, and it's actually 2 minutes to 5.